Congress. And ladies and gentlemen, now the coronavirus task force coming up here in the podium will give our thank you.
Welcome. Anyone missing?
Good to see you. You should space more. Maybe go to every other seat. Just like standing next to the people in uniform. Makes me feel at home.
Thank you very much. Thank you very much. We just completed a very good meeting of the coronavirus task force, and they're really doing a great job, our professionals. The results are very, very good. And when you compare this to what's happening around the world, we're very proud of our people. And there's been a tremendous amount of coordination with states, with cities, and they're a little smaller form of government, and they have things going well. They're coordinating with us, and certain in particular, I think California has been terrific, the relationship. New York has been really good. We've had some really good relationships in terms of especially the hotspots, and we're focused on those hotspots. Some areas we don't have no problem whatsoever, and we hope to keep it that way. Before I turn this over to our great Vice President to provide an update, I just want to express my appreciation for the hard work done by the people behind me and the people back in the various offices, including the fact that I just left the Oval Office, so we have some people there that are probably watching this, or they're just working. We're using the full power of the federal government to defeat the virus, and that's what we've been doing. Last week we secured an initial $8.3 billion from Congress for the coronavirus, and that was quickly done and very efficiently done. I want to thank all members of Congress. Yesterday I declared a national emergency, which was a very big deal because it opened up avenues that we would never be able to open up without it, and it will make more than $50 billion available to us immediately in disaster relief funds, and that's available for states, territories, and local governments. So that was really, really good. We also reached an agreement yesterday on a new legislative package that will provide strong support for American families and communities in dealing with the coronavirus. So it was done very, very bipartisan. It was very nice to see it. Probably the cooperation. I want to thank Secretary of Treasury, Steve Mnuchin, who did a fantastic job and worked with Nancy Pelosi and their representatives, and it was really great. It worked out very well, and a lot of people are benefiting by it. A lot of provisions in the bill, which they're going to be discussing with you today, and they're tremendous provisions. So that's something that we should talk about. I was honored to see that the stock market, you were mostly there with us, set a record in a short period of time, over a 45-minute period, that we had the press conference yesterday in the Rose Garden. That was a record, an all-time record. I think we should do one of them every day, perhaps. How about 5 times a day? We'll do one 5 times a day. But that was something to watch, and I had no idea. We walked back. I said, "So how did that work out?" They said, "Sir, you just set a new record in the history of the stock market." So that was pretty good. And those great companies that were there, they couldn't have been too unhappy either when you think about it, because they're all very big publicly listed companies. So they did a good job. And more importantly, they're going to do a good job. When you look at CVS and Walmart and all of the tremendous people that were there yesterday, these are the biggest and the best, and they're opening up their facilities. They're right now, literally working right now on doing something that's never been done before to the extent that we're doing it. And so we're very proud of them. Also, The bill provides for free coronavirus testing for all Americans who should be tested. So people that are getting tested are getting this free. They don't have to pay. 'Cause a lot of people say, gee, it's a lot of money. And it is. It's it's a pretty complex test, actually. And it costs money. And it's being provided free, so people don't have to worry about that. It also provides paid sick and family medical leave for those who need it, including for those who have the virus, for caregivers, and those looking after children affected by school closures. So that's all taken care of also. And we'll continue all of these different actions. We have other things planned. We're going to also be working with companies that are affected financially. Our country is in the best financial shape. We've so different than in the past over the years. If you look at some of the real big crises we had, it was financial problems and different things. We now are in very, very strong financial shape with all of the trade and all of the other things that we've been doing. It's been pretty amazing. We hope the Federal Reserve will finally get on board and do what they should do, because we're doing things that they should be doing, frankly, and we can all do them together, but they should be much more proactive. Other boards and other countries and people representing those countries are taking a much more aggressive action than our Fed, and for the most part. So we'd like to see the, if you look at central banks yesterday, what they did, we want to see our Federal Reserve be much more proactive. It's important. But in the meantime, we're doing things that have been really well received. I guess you saw that yesterday at the end of the day with what we've done. We have a lot of things to tell you in terms of respirators, in terms of all of the different things. The masks are being made by the millions and millions. We have plenty now, but we're ordering for the millions. We're ordering worst case scenario. We always say worst case scenario. And that's where we're going. So I just want to thank everybody. I think the press has been really, over the last 24 hours, I think the representation's really been very fair, for the most part, been very fair. We're all in this together. It's something that nobody expected. It came out of China, and it's one of those things that happen. It's nobody's fault. We all will solve this problem. We'll solve it well. I think the American people have been incredible in the way they've acted. There's been, and if you look at companies and sports leagues and all of the things, what they've done is just something very special, without being told necessarily. In some cases, perhaps they were told, actually. But for the most part, they want to get it over with. They want to get it over with quickly and with very little death. As of this moment, we have 50 deaths, which is a lot of good decisions were made, or that number could be many times that, but that's based on a lot of good decisions. One or two in particular. You know that Europe was declared the hot spot yesterday, a big hot spot, and number one, and we made a decision quite a bit prior to that, but we saw what was happening. But if you have any questions, this group will be very happy to do it. But I just want to say they have been, led by Mike Pence, they have been incredible, the job they do. They're working 20 hours a day. This man is working 20 hours a day, or maybe more. Is it more? I think it's more. Tony has been working. I'm just looking at this whole group, and we've created a number of new stars, including the gentleman right behind me. I watched him the other day. It was such a fantastic job you did, and I really appreciate it. But they're going to be answering questions, and we have a lot of new information, so I think you'll find it very interesting. And I'll be going back to the Oval Office. Thank you very much.
Mr. President, there are so many people right now that are rushing to Costco. They're rushing to grocery stores all over the country. They're filling up their baskets. Is that the right move? Do you think that people should actually be saying, maybe conserve as opposed to buy? Also, overnight, Apple, sir, they announced that they're going to be closing all of their stores for 2 weeks. Do you want to see other retail outlets, restaurants, stuff like that do the same thing?
I think it's fine if they do it. I think frankly, it's good if they do it. I think what Apple did is fine. And I want to keep people away for a little while. Just keep them away.
Well,
and when it gets better, well, people are going and buying things, and I understand that. By the way, I had my temperature taken coming into the room.
So did we.
You did? Good.
Yes, sir.
Let's compare. Do you want to compare?
Did all of us, yeah.
Good. Well, that means we're all looking good. I also took the test last night. Yeah. And I decided I should, based on the press conference yesterday. People were asking, did I take the test? I don't know, whatever it takes, a day or 2 days, whatever it is. They send it to a lab.
Why did you
But
Sir,
I
decide to take it?
you've been sending mixed
Only because
messages,
the press
sir.
is going crazy.
Mr. President, respectfully, you've been sending mixed messages. We watched as you shook hands with people yesterday. You have talked about 5 million tests being available, probably won't need that many. Has your own sense of urgency evolved, and are you changing what you're doing?
No, I've been urgent. This is urgent for me right from the beginning. You know that because I closed up our country to China.
But why are you shaking hands, sir?
Because it almost becomes a habit and you get out of that habit. And frankly, I was a non-handshaker for the most part. I never believed that shaking hands once you become a politician. And I notice it too. Political people walk up to me, they want to shake my hand. I said, well, you know,
Mixed message, sir.
just wait a minute. Just take it nice and easy, okay? Just relax. People come up to me, they shake hands, they put their hand out. It's sort of a natural reflex. And we're all getting out of it. All of us have that problem. Somebody comes up to you, they put their hand out, you probably tend to just shake it. And we're all getting out of that. Shaking hands is not a great thing to be doing right now, I agree. But people put their hand out. Sometimes I'll put the hand out, you don't think about it. People are thinking about it more and more. We have to think about it, it's important. Somebody said yesterday, I touched the microphone. I was touching it because we have different height people, and I'm trying to make it easy for them because they're going to have to touch because they wouldn't be able to reach the mic. They wouldn't be able to speak in the mic. So I'll move the mic down. And they said, oh, he touched the microphone. Well, if I don't touch it, they're going to have to touch it. Somebody's going to have to. So I might as well be the one to do it. But no, we all have to get away from, getting away from shaking hands is a good thing. And possibly that's something that comes out of this. Maybe people shouldn't be shaking hands for the long term because it does transmit flu and other things. You know, we have flu in our country that kills on average 36,000 people a year. 36,000 people. And, you know, that's something that we're not talking about. But as of this moment, we've lost 50, possibly a little bit less than 50, but probably 50 people. And we're going to try and keep that number as low as possible.
Can you tell us how you did the test? How did the test go?
Mr. President, the Pentagon is telling service members and their families not to travel domestically. Should all Americans follow that same advice?
Well, if you don't have to travel, I wouldn't do it. If you don't have to travel, we want this thing to end. We don't want a lot of people getting infected. We want it to end and end as quickly as possible. So far, I think we've done a fantastic job. I really think that the people behind me have not been given the credit that they deserve because they have done a fantastic job. When you see all these school closures, the school closures are very important, but it causes a lot of problems. The bill that we signed yesterday takes care of a lot of those problems with children staying at home and the parents are working. Now we take care of that issue with what we passed last night. Now it has to go through the Senate. I have to sign it, but that will happen. But I'm now going back to the White House. You have great professionals, and if there's anything that comes up, if there's anything...
Mr. President, thank you, Mr. President. I just wanted to follow up on that. Are you considering other travel restrictions, perhaps domestically,
Yes.
in that regard? And can you describe what type of
Specifically from
possibilities?
certain areas, yes, we are. And we're working with the states, and we are considering other restrictions, yes.
Reuters is reporting that you're going to extend the European travel ban to the UK and Ireland on Monday. Is that accurate?
We're looking at it very seriously, yeah, because they've had a little bit of activity, unfortunately. So we're going to be looking at that. We are actually already have looked at it, and that is going to be announced.
You just criticized the Fed yet again. If I could just get a little clarity on your thinking on this.
Yeah.
It's been a hallmark of your presidency. You're always going after the Fed. If you feel so strongly about it, why don't you dismiss the chairman, or do you think you're powerless to do so?
No, I think I have the right to do that, or the right to remove him as chairman. He has so far made a lot of bad decisions, in my opinion. We had this great, and we will soon have again, because I think you're going to have a tremendous bounce when this is over. I think there's a pent-up bounce that's going to be tremendous. I think you saw that yesterday with the stock market. Now, I'm not happy with the Fed because I think that they're following, not leading. We should be leading. I'm not happy because if you look at the central banks of other central banks, largely they're lower than us, their rate, and their equivalent of the Fed rate is lower, in some cases by 2 points. In some cases, that's a lot. In some cases, very substantially. And I thought that the Fed would be and should be much more proactive as opposed to following. Our Fed is following. We have the #1 currency in the world by a factor of many times, as you know. We have the currency, we have the power, we have by far the strong currency. Also, you look at the dollar, the strength of the dollar. Our Fed is not doing what they should be doing. We shouldn't have a Fed rate that's higher than our competitor nations. You look at Germany, they're essentially under zero. They're negative. There are many countries negative. Japan is negative, Germany is negative, others are negative, and we're paying higher interest rates. And what I'd like to do is, frankly, refinance our debt. We could refinance our debt very easily at a much lower rate. We have some tremendous opportunities right now, but Jerome Powell is not making it easy. No, I have the right to remove. I'm not doing that. No, I'm not doing that. I have the right to also take him and put him in a regular position and put somebody else in charge. And I haven't made any decisions on that.
Was your temperature normal, Mr. President?
Totally normal.
Hello, Mr. Vice President.
Well, good afternoon, everyone. As the President just said, we just completed the White House Coronavirus Task Force meeting in the Situation Room, and we continue to implement the President's vision, not just for a whole-of-government response to the coronavirus, but a whole-of-America approach. The focus of our task force today and going forward is on implementing the President's public and private partnership on testing, focusing on ensuring that state and local authorities have the guidance and the support to ensure mitigation, particularly in areas where we've seen community spread. And we're continuing to lean in at the President's direction on addressing capacity issues in our hospitals and with regard to equipment. Let me reiterate the President's gratitude, not just for the team behind me and the team behind them, all of our federal agencies that are literally working every day to bring a whole-of-government approach to this, but we also want to commend all of the governors across the country. I'll be speaking again to all the governors, all 50 states and the territories tomorrow. But as the President said yesterday in the Rose Garden, we couldn't be more grateful for all of the governors, particularly in areas where we've had community spread, for the seamless cooperation that's taking place. And we commend local health authorities and all of those who are literally on the front lines. Also grateful for all the businesses that you saw in high relief yesterday, businesses around the country, in sports and entertainment, in retail, that are making decisions based on CDC guidelines and good common sense to protect the American people. And lastly, as the President also said, we just want to thank the American people for listening to local authorities, listening to recommendations from the CDC. We'll hear more about that in just a moment from Dr. Fauci and Dr. Birx. But as we're seeing, not surprisingly, as we've seen in the past, the American people are all responding to look after not only their own health, but their families and their communities. And one story after another is truly inspiring to the President and to all of us. As you know, it's been a brisk few days. The President declared a national emergency yesterday, freeing up significant federal resources for state and local authorities, as well as our national response. The President announced that unprecedented public and private partnership on testing. And let me say that at 5 o'clock tomorrow, we will be detailing the progress that our team is making. I can tell you they are literally working around the clock with private companies. We are very pleased that Thermo Fisher was just approved last night by the FDA in record time to also be providing what's called a high throughput test. That will actually increase the capacity of this public and private partnership. But again, details on that in terms of when the local sites will be available at CVS and Walgreens and Walmart and other locations, what communities those will initially be available in, when the website will go online, as well as how this will continue to roll out. 5 p.m. tomorrow, Eastern Standard Time, will detail that. Last night, the House of Representatives passed legislation which addressed the priorities that President Trump had laid out for the American people in the weeks before that. I want to join President Trump in thanking Speaker Pelosi, Leader McCarthy, the Republicans and Democrats in the House of Representatives who, as the President said earlier today, pulled together to pass legislation that's meeting this moment in the bipartisan, health-first spirit that the American people would expect. The Secretary of the Treasury will detail the legislation, but to be clear, the deal that passed the House last night will head to the Senate early next week, delivers on the President's plan for strong health and economic support, particularly focused on those most impacted, including hardworking blue-collar Americans who may not currently have paid family leave today. It provides free coronavirus testing for uninsured Americans, and it builds on the decisions that President Trump made, expanding coverage for Medicare, Medicaid, and also getting a commitment from private health insurance companies to join with us to waive all copays on coronavirus testing. So now testing will be free for every American, those who have insurance, Medicare, Medicaid, other programs, and even the uninsured. The legislation also establishes tax credits that the Secretary of the Treasury will describe that will provide paid sick and family medical leave for coronavirus-related employment interruptions. I expect Dr. Birx and Dr. Fauci will reiterate this. If you are sick, now you need not be concerned. If you're an hourly wage earner in America, you need not be concerned about staying home. If you're sick, stay home. You're not going to miss a paycheck because of this legislation that's moving through the Congress. Will make sure that your employer, including small businesses, have the ability to provide paid leave to you. This also provides funding and flexibility to ensure that senior citizens, women, children, and low-income families have access to emergency nutritional assistance, and it incentivizes states to ease access to employment benefits. Again, the President and I are profoundly grateful for the bipartisan spirit that drove this legislation, and let me also say how grateful we are with the Secretary of the Treasury and the long hours that he put in negotiating this measure. Let me say also last night at midnight, the Department of Homeland Security implemented the President's decision to suspend all travel from Europe, passing through 13 airports. Acting Secretary Wolf will detail the implementation of that. To be clear, countries where we have suspended travel under Section 212F, Americans may still return to the United States. Legal residents may still return. They are being screened at some 13 airports as we speak. If they are identified as being symptomatic for any illness, there is an additional response on site, but those Americans are being encouraged to return home and self-quarantine for 14 days. That started at midnight last night, and the Secretary will detail it. In a few moments, I'll ask Dr. Fauci to update us on cases, as well as current CDC guidance for all Americans. And all of you are already aware that this week we issued specific guidance to about a half a dozen states where we've seen community spread. Dr. Birx will touch briefly on the public-private partnership testing plan and also speak about what the data is showing at this moment about the best guidance for every American. Acting Secretary Wolf and I both want to join the President in commending the cruise line industry. They made a decision yesterday. 85% of all the domestic cruise lines announced that they would be suspending cruise line operations for a period of 30 days. And Chad Wolf will explain to you the importance of that decision. We want to commend the cruise line industry for working with us. And as we met last week on this day with cruise line industry executives, we're going to be working very vigorously over the next 30 days to implement new policies that'll ensure that when the cruise lines start back up, they'll be safer and healthier places than ever before. But a great industry, American people love it and enjoy it, and we're going to make sure that it's there for many, many years to come. Also, as the President just foreshadowed in our task force meeting today, the President has made a decision to suspend all travel to the United Kingdom and Ireland effective midnight, Monday night, Eastern Standard Time. Chad Wolf will describe the details of that, but again, as the President just suggested, all of our health experts presented information. Dr. Fauci will reflect on some of those numbers, made a unanimous recommendation to the President that we suspend all travel from the UK and Ireland. That will be effective midnight, Monday night, Eastern Standard Time. Again, Americans in the UK or Ireland can come home. Legal residents can come home, but as the Secretary will detail, they will be funneled through specific airports and process. We continue to emphasize that the risk of serious illness for the average American remains low. But the data shows that seniors with serious underlying health conditions are our most vulnerable population, the people most susceptible to serious medical outcomes. Seema Verma in a few moments will talk about the President's decision yesterday to restrict all visitors in all nursing homes around the country and other measures that we have taken. But it's so important. It's so important for all of us who are blessed with having senior citizens in our family, like my 88-year-old mom. Let's look after seniors with serious underlying health conditions and make sure that every American around them is practicing the best kind of hygiene, the best kind of measures to ensure that they're not exposed. We'll hear also from Dr. Carson and the Surgeon General before we wrap up and take some questions. With that, let me recognize Dr. Tony Fauci for an update on where we stand and recommendations and guidance.
Thank you very much, Mr. Vice President. Just a quick review of the numbers as of late afternoon yesterday. Let me start off quickly globally, and then we'll go to the United States. Right now, there are 129 countries that have involvement with coronavirus. Globally, the numbers are 132 plus thousand. So it's a little bit more than 132,000, about 7,500 of which are new cases. Importantly, and this is something we've mentioned over the last couple of days, that if you look at what was formerly the main feeder of this coronavirus outbreak was China, they have 80,000 or 81,000 new cases, but only 11 new cases and only 7 new deaths. Things have switched over now to outside of China, which has actually triggered our decision, the decision of the President, to do the travel restrictions in other areas besides China. And I think it's important to recognize that, because when this is all over and it will end, you will see a curve of how the coronavirus outbreak evolved. It's not going to be a unidimensional or homogeneous, because countries are going to do this and then that. We've seen it already with China. We're starting to see it with Korea, which brings us now to what we can expect in our own country. So if you look at the domestic cases, there are about 2,226, including the repatriations, 50 deaths, 532 new cases, and 9 new deaths, which means we have not reached our peak. Now, we will see more cases and we will see more suffering and death, predominantly, as the Vice President said, among the vulnerables in our society, the individuals with the conditions that we spoke to and the elderly. But built in that is a challenge. And the challenge is we still have the opportunity to influence the course of that curve. So what we would like to see is that when this is all over, our curve was not like that. Our curve was like this. So that's the reason why we're implementing the things we're talking about. And finally, I just want to make a comment about yesterday. You know, as a physician, which is what I primarily am, who takes care of patients every day before I was doing this, is that there are things that happened yesterday that I think are going to be really important to the people out there who are going to be impacted by this, but particularly by the physicians. And that is the President declaring a state of national emergency, because that will be what I thought the word that I use is essentially unshackling us from any of the things that are going to get in the way of our implementing, particularly the new powers giving to the Secretary of HHS, Alex Azar, and the departments within his agency, particularly CMS, which you're going to hear about shortly. And within that group, particularly the nursing home situation, which we've really got to protect. The other thing is, we always get asked about testing. You saw the CDO out there. Now it's all systems go. Let's look forward. The responsibility is going to be with us, but also with them, because as we get knowledge about new testing, we'll alleviate the anxiety that we have in the world about we don't know what's going on, but it also will give the individual physician and individual citizen the opportunity to know where they stand. I'll stop there and happy to answer questions later. Thank you.
Thank you, Dr. Rocha.
Thank you. Thank you. Good afternoon. I just completed my second week, so I want to just start with the 4 things that I have learned in the last 2 weeks. One, we're at our best when the country comes together in a bipartisan way, and that has really been extraordinary to witness. But secondly, what you may not have seen as much of is the willingness of state and local governments to work together with the federal government in a seamless way, independent of party affiliation. The third thing has been the remarkable decrease in bureaucracy and red tape in order to get us to where we are today. This is particularly evident in the CDC. And then finally, the understanding that in order to unleash and serve every American, we have to create public-private partnerships that bring together the extraordinary strength of our private sector. So when we saw issues with testing, and again, I want to remind everyone, it was a surveillance system that was set up by public health institutions in the United States, our CDC, to be a surveillance test. We then, because there was no other, moved it to a diagnostic test. But now we have the full power of our testing capacity. What do I mean by that? We're looking at what it will take to have consumer access, and that's what the private sector is bringing to us. Secondly, we had to have automated high throughput testing because we want the American people to be able to get their results quickly, and you've heard from Roche and Thermo Fisher that access. But finally, we want to make sure that patients get results. And that was what's critical in that bill yesterday on reporting and requiring reporting, because obviously as we decentralize, as we move out of state and local laboratories, public health laboratories, as we move out into the hospitals and the communities, we need to know about the test results so that we can focus resources where they're needed the most. Finally, I want to conclude with something that's very important. When you are tested, and our results look very similar to South Korea now to date, where South Korea, 96+% of people with symptoms were negative. That means also that they had respiratory symptoms. Let's remind all of us, most respiratory diseases are contagious. So if you have any respiratory symptoms, you want to protect yourself and treat yourself, but you also want to protect others. And so let's everyone assume when they have a respiratory illness that you have a contagious illness, because if it isn't allergies, it's contagious. And let's use those precautions across the board. And when you get a negative test, that means you're negative that day. That doesn't mean that you couldn't get the virus spreading overnight, because it replicates in your nose and your nasal secretions, and you would have a positive test tomorrow. So if you have a negative test, that doesn't mean that you can discontinue precautions. It doesn't mean you can start taking risks because you were negative. So let's ensure that if you had symptoms, you are contagious. Let's treat yourself as being contagious. And if you have a negative test, let's make sure that you're still protecting others from whatever you do have, and that doesn't reassure you personally and you take additional risk. Finally, I just wanted to conclude with a group of clients and patients that we are all very worried about. These are individuals that we call long-term survivors from HIV that are here across the country that have survived more decades with HIV. Many of them still carry a level of immunocompromise. To all of them out there, please take care of yourself. Please ensure that you're doing everything possible to ensure you don't get exposed. Thank you.
Thank you, Deb. Great comments. Mr. Secretary, on the legislation that passed the House.
Thank you, Mr. Vice President. So first, in particular, I want to thank Kevin McCarthy and Kevin Brady and all the Republicans on the House side who worked with us round the clock. I'd also like to thank Mitch McConnell and his team who were providing us input as well. I especially want to thank Speaker Pelosi, who was literally available to us round the clock for the last 3 days. And also want to just thank the Vice President and the President, who were very specifically in the details